Dr. Nate Larsen is our medical director of the emergency department in Fond du Lac. Thank you so much for joining us.
Yeah, thanks for having me.
So before we get into the specifics about the emergency department at the campus, we want to know a little bit more about the community itself. We hear that you are a native of Fond du Lac. So what makes your community so special?
Well, there's all kinds of things to do in the community. It's close, it's a small town feel, but you're close to a lot of other big cities. So if you can't find what you want to do in Fond du Lac, it doesn't take that too long to get to Madison or Milwaukee or Appleton up the Fox Valley. But it's got 4 seasons. We like outdoor activities as far as biking and boating, and I've lived there for a long time. So I consider myself a native even though I wasn't born there.
And any hidden gems in the community that you want people to know about?
Yeah, it's the 4 seasons, right? So the fishing tournaments and the ice sculptures and the outdoor activities. So it's a different world when the lake freezes over and you can drive your car on the lake. So something that not everybody gets to experience.
Absolutely. So let's talk a little bit about the emergency department itself. We've been in there. We're seeing it now come to life. It's super convenient and it's comfortable. What was, the basis behind the development of that emergency department?
Well, as far as the location, it's number one. It's where everybody is at. So it's right off the freeway. It provides easy access into the campus. And it's obviously strategically located between Frederick and ThedaCare up in the Fox Valley. So even if we can't provide the care there, and it gives us a direct avenue north or south to give them to the next campus that they need to a higher level of care.
Can you talk a little bit about that? Because it's an entire fully staffed emergency department, and if people do need that next level of care, what are their options?
As far as options to get transferred, usually it's by ambulance. So we have ambulance services will be set up to be transferred, but you've got cardiology, you've got neurology, neurosurgery, up in Appleton and Neenah, and we're now integral part of Frederick. So we're now merged into one healthcare system. So we have that just down to the south in Milwaukee, which is just a hop, skip, and a jump away.
So how important is it for the patient who might need additional care options after they leave the emergency department?
Well, we have referral options for pretty much every specialty. So if we can't get them locally in Fond du Lac, obviously it's just the closest would be Appleton and Oshkosh. So we can get them referred into the specialist, but we'll have obviously primary care there in Fond du Lac as well to refer back to. So being able to just make those connections and getting the patients plugged into the community to the services they need if it's not emergent care.
In your years, you've been practicing medicine for a long time, seen many, many changes. How has emergency medicine sort of evolved and become more comprehensive and really that personal connection?
Well, it's usually still the front door of the hospital system. So, we get to see patients at their worst. That's usually not a good time when they're coming to the emergency room. They're usually having the worst day of their life many times. And so, get to have that opportunity to interact with them and be able to help them through that process, and then help them get them transferred to higher level of care if need be, or be able to care a lot of primary care even through the ER stay and get them plugged back into the community. Again, the ER is just a piece of that component, but it's an integral piece of that component. So it's exciting to see a new facility and having ER close to my hometown or in my hometown. So
yeah, what have you heard from the people so far? Are they excited?
They're excited. Yeah, there's a lot of excitement and when are you opening? When are you opening? They're wanting to know when they'll be able to start using our services there in Fond du Lac.
All right, Dr. Larsen, as we're looking ahead to the opening, what are you looking forward to most?
I think being able to just care for friends and family and acquaintances back in the emergency room and being able to see them back in the community again. It's something about being able to walk out to the stores or restaurants and being recognized, and people are very grateful.
All right, Dr. Larsen, thanks so much for being with us, and we're looking forward to the opening.
Yeah, me as well. Thank you.